Welcome, everyone. I'm Kim Hanson, Executive Director at Diabetes Canada. I'm so glad that you could be here today. We're here to talk with those of you who might be living with or otherwise affected by diabetes about how you can find supports during COVID-19. I'm thrilled today to be joined by Member of Parliament for Carleton, Pierre Poilievre. Thank you so much for being here, Pierre.
Great to be with you.
Today, we'll be answering some questions that MP Poilievre is hearing from his constituents, of which I am one, and we'll be taking questions from those of you watching the webinar. Just a couple quick housekeeping notes before we get started. We are recording this session so that anybody who wasn't able to tune in live can watch it after the fact. If you've got questions, you can make them in the chat function at the bottom of your screen. Et vous pouvez poser vos questions en français ou en anglais, comme vous préférez. Je serai ravie de répondre dans n'importe quelle langue. Let's get started, Pierre. Diabetes is a big burden for many Canadians. Tell us about that, and tell us about how our government is supporting people with diabetes through the COVID-19 pandemic.
Thank you very much, Kim, for including me in today's conversation. It's great to be with you and your members to talk about the response to COVID-19. So first and foremost, the average person whose diabetes is not too severe to keep them from working, their main benefit they're getting from the Government of Canada is the disability tax credit. And that entitles them to a tax savings of roughly, I think works out to what, $1,300 or $1,400 a year. That takes into consideration some of the costs of working that are associated with having diabetes. To qualify for that tax credit, you need to be using 14 hours of life-sustaining treatment per week. If you do that, then you qualify. I think you need it. Kim can correct me if I'm wrong. I think you need a physician to sign off on that requirement, and then that entitles you to receive that tax break. It's a significant tax break, very helpful. Those people who have lost their jobs due to COVID-19, of course, are entitled to receive some of the new benefits the government has produced. The most obvious being the Canada Emergency Response Benefit, which is $2,000 per month for anybody who stopped working as a result of COVID-19, or anybody who and anybody who continues to earn less than $1,000 per month. So 7 million Canadians now receive the Canadian Emergency Response Benefit, and people with diabetes are obviously entitled to apply for that if they've lost work due to COVID-19.
Great, thank you. These are helpful tips that Canadians can avail themselves of, and more information about the emergency benefits that have been made available during COVID-19 can be found on the Government of Canada's website. If anyone has questions about the disability tax credit, I certainly invite you to contact us at Diabetes Canada, 1-800-BANTING, or via our website. Now, Pierre, I know that many Canadians with diabetes are wondering whether they're at greater risk to COVID-19 because they live with diabetes or prediabetes. And so I guess what I would say, based on the latest research that we have, which is, I should say, very emerging, is that you're not, as far as we can tell, at greater risk of catching COVID-19 because you have diabetes. What we know, though, is that if you have diabetes, you're at greater risk of a more severe form of the infection, maybe about twice as likely to require hospitalization due to COVID-19. So if you're living with diabetes, it's important that you avoid catching it if at all possible. And we do that, as we know, by staying home, by practicing good hygiene, washing our hands, and by practicing physical distancing. At the same time, I think it's really important that all of your constituents, Pierre, remember that it's important to control your blood sugars and your diabetes as well as possible to help minimize the risk that you'll develop complications if you do catch COVID-19 or anything else. So do monitor your blood sugar as per your doctor or your healthcare provider's recommendations. Do make sure that you check your feet if you're living with diabetes. Make sure that you're taking your medications as prescribed, and adjust your doses if you find that your need for medication has changed while you're in quarantine and maybe getting a bit less physical activity than you were before. See if you can practice physical activity like yoga or take a walk in your neighborhood in order to keep yourself active. And if you've got questions about how you can manage your diabetes or about diabetes in general, we're really pleased at Diabetes Canada to have just launched last week our diabetes education line, where Canadians can call our 1-800-BANTING line and access diabetes educators free of charge. They'll respond within 24 to 48 hours to your questions about your diabetes and give you customized expert advice. So that's free of charge. It's available in French and English by calling 1-800-BANTING. Pierre, another question that I often hear from patients who are wondering how they can access healthcare and take care of their diabetes on their own during COVID is what healthcare is available. We know that doctors' offices aren't necessarily open as per normal, but what can your constituents do if they need medical advice or healthcare?
What I understand is that most family doctors are doing virtual meetings with their patients to consult with them. I think that they're able to give referrals in the aftermath of those virtual interactions, so you can go to your doctor, have a conversation, and then your doctor can say, look, I think that you need to see a specialist based on the symptoms that you've described. Then you can get that referral. You probably could get it faxed to you. If you need your prescriptions, they can probably fax the requisition over to your local Shoppers or other pharmacy. I know that if you're having a hard time getting around, many of the pharmacies are doing home deliveries. In Manotick, for example, Shoppers and Phil's pharmacy are both delivering to your home. You just have to call and they'll arrange to have the delivery done right to your doorstep. So take advantage of those things. It is, it depends where you are in Canada. Some basic healthcare services are being put on hold because as the local health authorities try to conserve space and resources for COVID-19 treatment. But here in Ottawa, I know that has happened, and some people have had their appointments canceled for non-urgent treatments, and so you have to plan ahead, because it's not going to be like it was, say, 4 months ago pre-COVID-19, where your appointments would happen on a normal schedule. You might actually have to wait a longer period of time, given that that certain local health authorities have canceled procedures and appointments in order to maximize the available resources for a COVID-19 wave.
Thanks, Pierre. That's certainly what we're hearing. And in fact, I've had experience myself of something that I think is perhaps a bit of a silver lining out of this pandemic, which is it was time for my regular appointment with my diabetes specialist. And I was expecting that it might be canceled, but instead, rather than cancel it, we conducted the meeting by telephone. And I shared my blood sugar readings online with my doctor and the nurse, and they were able to review it and offer me some advice over the phone. And it was really, really great. And I think a really good example of a way that we could perhaps practice healthcare even during non-pandemic times that might help to relieve some of the burden on the healthcare system, as well as preventing those of us who need to see specialists from having to take a half a day off work in order to do it. So depending on your situation, you may be able to still access virtual care. Some some more elective procedures and things might be delayed. But if you ever have concerns about your health, feel free to go to emergency rooms. They are still safe. They are still open to non-COVID related things. And you should definitely feel free to take care of your health as you would during normal times.
Absolutely.
I'd like to, if it's okay with you, Pierre, I'd like to tell our viewers about a few ways that Diabetes Canada is working a bit differently to help those of you affected by diabetes during the pandemic. I want to first of all reassure you that now more than ever, Diabetes Canada is here to support you. We are doing it differently. We're doing it entirely virtually, like so many businesses and other groups, but we're still very much here. We know that you're often worried, you're looking for information, for resources, and for connections with each other, and that's what we're working to provide. So I mentioned earlier our 1-800 Banting line, and it's available for any questions if you're looking for resources in your province that you can connect to in order to get support for the costs of living with diabetes. They can help point you to them. As I mentioned, if you've got questions about the disability tax credit or other related programs, they can help you with those, or they'll get you to me and I will gladly help you. And then we've also got a website, Diabetes.ca/coronavirus, which offers a number of tips and tools and resources about the relationship between diabetes and COVID-19. It's got infographics to let you know about the safety of the insulin supply or the diabetes medication supply. It's got a letter that you can print off and share with your employer if you have diabetes and are looking for modifications to your work arrangements to be made to reduce the risk that you would catch COVID-19. So there's lots of things there. I would really encourage you to visit our website. We're offering a weekly video series called Ask the Experts, where our followers are asking us questions about diabetes in general or diabetes and COVID-19, and we're getting expert endocrinologists and educators and nurses to answer those questions on videos. So they come out usually every Friday, and there's a whole bunch of them available on our YouTube channel that you can watch. We're working on plans to bring you virtual conferences, whether you live with type 1 or whether you're just looking for maybe a support group that's specific to your community. We're going to be offering those all using virtual technologies, so stay tuned. And then finally, we're working really hard to keep your healthcare providers, whom we represent, as well as the patients living with diabetes, up to date on the latest research on diabetes and coronavirus. And so they are being offered webinars about once a week to educate them on how they can provide virtual care for their patients during the pandemic, or what the latest research is telling us about the risks of COVID and how to minimize them. And so we're really pleased to share those with you and would love your feedback on how those resources are meeting needs, or what else we can do to meet them. So Pierre, a question that I have heard from one of the viewers in preparation for this webinar is this viewer was saying that they heard that there were some challenges with people with diabetes accessing the disability tax credit a couple of years ago. What information do you have about the current state of things? Are you getting any concerns expressed at your constituency office? What's the latest?
Well, I've not heard any new concerns. I know that back in I want to say early 2018, the government the CRA tried to, through a letter from the minister responsible, tried to arbitrarily take the disability tax credit away from diabetics, even though the law clearly states that diabetics are entitled to the credit as long as they have 14 hours per month of life-sustaining therapy. So we fought back against that, and the government backed down and reinstated the tax credit for diabetics. I know the Conservative caucus is working to simplify the disability tax credit, to expand what is considered life-sustaining therapy to include things like special dietary planning and as you know better than anyone, diabetes requires very carefully calibrated portions of different kinds of foods in order to regulate blood sugar and maximize health. None of those things are considered part of the 14 hours of life-sustaining therapy that are required to obtain the tax break. So Conservatives are wanting to expand the eligible activities that are calculated into the 14 hours so that more diabetics qualify. If you're spending 20 hours a week just staying alive, that is an enormous economic cost to a household. That's 20 hours you're not spending earning wages. And therefore this tax credit, which is actually pretty modest, it works out to about $150 a month, not even $120 a month in reality, should be available to you. And so those are some of the things we're doing, and we're open to suggestions. I think our tax code is far too complicated for everyone, but in particular, it's complicated for people with disabilities who have to jump through a lot of hoops just to get these modest tax breaks. And we see these consultants pop up advertising how they can help get you the tax credit, and then of course they want to take a cut of your share of that break. I'd rather simplify the tax credit in a way that allows anybody to figure out how to use it themselves rather than having to pay an expert to do it for them. So frankly, government is too complicated for all of us, and it is especially too complicated for people who already have enough complications in their lives, and that means people with disabilities.
Here. I think Diabetes Canada would most definitely support any efforts to simplify the disability tax credit and other related programs. I would say that the Disability Advisory Committee that was struck partly thanks to the intercession of a number of people with diabetes who were concerned about the challenges accessing the disability tax credit, has made a number of recommendations, and we're really hoping that the Canada Revenue Agency and the Finance Department will implement those changes and help to streamline the administration of the program, not only for people with diabetes, but for people with all forms of disabilities.
Absolutely.
Here, another question that I would ask you. This is kind of a personal question, and I would like to just invite any of our viewers to share any questions that they might have by typing into the chat function at the bottom of their screen. One of the recent times that I saw you was when Diabetes Canada appeared before the Finance Committee earlier this year as part of your pre-budget consultations. Pierre, you are Vice Chair of the Finance Committee of the House of Commons. And we were so pleased and grateful to see that our Diabetes 360 nationwide strategy, which we've been recommending for Canada, was equally recommended for inclusion in Budget 2020 by the Finance Committee. I'd be interested, Pierre, is there anything you can share with us about what the Finance Committee's take on that was and why you chose to recommend it for funding and why you think it would be valuable for Canadians?
Well, thank you for the question and for your testimony before the Finance Committee. I know that you've been advocating this initiative for a very long time, and obviously the budget process now is sort of turned on its head. I don't even know if there's going to be a budget this year because all of these measures have been rolled out outside of the budget processes. necessarily so, because there's been no time to wait. And so right now we're waiting to see, will there be a budget? And if not, will there be perhaps a smaller fall economic update in which initiatives like this might be included? But I'm telling a lot of people right now, don't expect a budget. I don't think the government's going to come down with one. It's already May, and you almost always have a budget by now. So I think the government's just going to avoid a budget and look at doing something like a fall economic update in October in order to make the normal updates to our fiscal framework that you would typically expect in a budget. So that would be the next target date for you to consider pushing this agenda. Basically, anyone who's not focused on COVID-19 right now is not getting anywhere with the government for understandable reasons, because the government's responding to this massive crisis, which is all-consuming, is basically demobilized half of our economy through the shutdown, and then brought in $150 billion of compensation to make up for the losses that businesses and individuals have endured. So we'll have to see what what they do with the budget process and with the Finance Committee's recommendations when they come back to it.
It's certainly unprecedented times. I think it would be fair to say that none of us could have imagined 2 months ago what our day-to-day would be like today, could we?
Right.
So for that. Pierre, are there any, I know that many of our viewers today are constituents of theirs. Are there any common questions that you're getting to your constituency office, or any special services or advice that your constituency office is providing to your constituents during the pandemic?
Yes, I mean, there's obviously 7 million people have applied for the Canada Emergency Response Benefit. Hundreds of thousands have applied for small business assistance of various kinds, the wage subsidy, the rent subsidy, the emergency business account, and other programs. So many people are having a hard time qualifying or accessing these benefits. They are welcome to call their local member of parliament. So basically, call your MP if you think that you might be entitled to one of these benefits, but that you're having trouble accessing it. We have in our office, for the people who live in my riding, we have a full-time caseworker. In fact, other staff members who typically were responsible for different things are now jumping in to help with casework. So we promise a very prompt response. If people need help and they live in my Carleton riding, then I encourage them to call and reach out.
Fantastic. That's a great service that you're providing. I see we have a new question. The comment from our viewer is, thank you for doing this. I've been living with type 1 for almost a year now. I have personally spent money to hack together technology so that I can read my blood glucose on my watch. It works really well, and I'm thriving because of it. Please consider covering these hacks through a tax benefit. So if I can start, Pierre, and then invite you to add any comments. I just want to say, Gordon, I'm sorry to hear that you're also living with type 1. I've been at it for 25 years, so there are certainly ups and downs associated with it. And like you, I have a continuous glucose monitor that I simply couldn't manage without. And yet we know that technology like continuous glucose monitors, and moreover, the other technologies that allow us to do fancy things like looping or read CGMs on our watches, etc. Those technologies are not covered by all private insurance, and they're certainly not covered by public insurance. Some flash glucose monitors are covered by some provinces to a certain degree. So Quebec has some coverage, Ontario has some coverage. Yukon has just blazed a trail by announcing last week that it will provide coverage for continuous glucose monitors for people living there with diabetes. And Diabetes Canada just thinks that's commendable. I think that the policymakers in Yukon have realized that when people with diabetes are able to use technologies like continuous glucose monitors, we're better able to keep our blood sugars in a healthy range. We're better able to understand patterns in them and adjust our doses of medication. And that protects our health both in the short term and the long term. So it's worth the investment. But not every government is seeing it that way. And so Diabetes Canada is working hard to advocate for that coverage. And if you would like to get involved and add your voice to our advocacy for that, that would be wonderful. Please feel free to email me at Kimberley, and that's got an L-E-Y, thanks mom, .Hanson, Hanson, at Diabetes.ca. I'd love to hear from you. Okay, if you've got any other questions, I would love to hear them. This is to our viewers. We're getting to the end of our questions and to our time, but Pierre, before we sort of end off today's session, is there anything else that you'd like to say to your constituents or to our other viewers who are living with diabetes about how our government is here to support them in normal times or during this pandemic?
Well, I would conclude by saying I know it's been a very difficult time for many people. Many of you are feeling lonely. You've lost access to your job and your normal income. And so you're probably suffering, and you're checking your bank account every couple of days to find out if you're going to make it through. I think there is light at the end of the tunnel, and provinces are now talking about reopening slowly but surely. And that will allow people to start to get back to their jobs. We're going to continue to, as a conservative opposition, one of our major priorities is to ensure that the programs, the safety nets don't become trap nets. So for example, if you are on the Canadian emergency response benefit, we don't think you should be punished for earning more than $1,000. You know, as you get back into work, you might want to keep the benefit while you get your job, because that way you can have a safety net in case your employer goes under or the lockdown resumes. A lot of people right now are going to fear earning more than $1,000 because then they'll lose their response benefit. And we think that would be unwise of the government. Many people will be banned from working if that ceiling remains in place. So we want to remove those sorts of penalties that people are going to face as soon as they go back to work. Likewise, if I know that Kim, your parents were business owners before their retirement. There are many penalties for small businesses who make too much revenue. For example, you can't get rental assistance unless you've lost 70% of your revenue compared to a year earlier. Well, a lot of businesses are having to make the calculation that if they earn more than 30% of their pre-COVID revenue, then they'll lose rental assistance and they won't be able to pay their rent. So again, we think that's a narrow-minded approach of government. It's ultimately going to be punishing businesses for trying to get back on their feet. It will also encourage many to close their doors in order to keep their revenue low enough to qualify for rental assistance, which is completely the opposite of what we want to encourage. So our major focus as conservatives is going to be on removing these penalties for work and entrepreneurship, so that as the economies reopen, both workers and entrepreneurs are rewarded rather than punished for getting back up on their feet.
Great. That all sounds like it makes great sense, Pierre. And I would say, I think I can safely speak on behalf of all Canadians in saying how grateful we are for the work that all of our members of Parliament are doing, representing all parties, to ensure that these supports are put in place as quickly as possible and that they really do meet the needs of Canadians. So thank you for what you are doing, along with what your colleagues are doing. We're very grateful.
Thank you, Kim, and thanks to the Diabetes Canada for all you're doing. Keep up the great work, and I look forward to seeing you all in person as soon as it's safe.
Absolutely. So with that, thank you to our viewers. We're so glad that you took the time to be with us today. There will be a recording of this made available on Diabetes Canada's YouTube channel and on social media, so feel free to share that if you'd like with anybody who missed it. And don't hesitate to reach out to Diabetes Canada, 1-800-BANTING, if there's anything that we can do to support you. Thanks everyone, and be well.
Thank you.